Good afternoon, everybody. Again, this is our 3:30 briefing time. We're doing this daily as an update to the community to be sure that people stay on top of information, and it's our commitment to everyone to have good, solid, local information available for everybody. You've probably noticed by now that things change quickly. We're trying to keep up with those changes as we hear about them, and we want to make sure that the community is aware of those changes as well. Certainly, all of us are having to respond to that changing environment, both personally and professionally. We know that's hard, and we are walking that road with you. Earlier today, I announced that we were notified this morning of our first COVID-19 positive case in Eau Claire County. As a reminder, this is a travel-related case. This person has been at home since they've returned from travel. All known contacts are being notified. It's the basic public health process that we have. The investigation is happening, and we are working very closely and carefully with the individual. It really illustrates the importance of how we are handling this public health emergency. As people are identified as being ill and stay home, we frankly have many fewer people that we have to talk to follow up with, to have them self-quarantine as a contact of a case. That helps slow the spread of disease and is an important measure. Again, because of that, all that process that's happened with this case, the risk of illness to the general public is extremely low and has not changed. It does demonstrate, though, again, the importance for all of us to pay attention as community members to the new state rules on mass gathering and to use basic public health measures that we have in place. Again, some social distancing and using good hand washing and making sure that you stay home when you're ill. I know that there's been a lot of questions about testing. Again, we've talked about that daily, but we do, again, have updated testing information related to our county testing. We'll have that about once a week. We know right now that we've had over 130 tests done in Eau Claire County. So again, the sample has been taken of more than 130 individuals in Eau Claire. The results are negative or pending for everybody except for the one person, again, that we've identified as COVID-19 positive. In the state of Wisconsin, the numbers for today are 155 cases of positive COVID-19 in the state, with over 2,100 negative tests. Again, I want to reiterate that we don't expect this to be the last COVID positive test in Eau Claire. We can expect that there will be people, because of travel, because of contact with COVID-19 cases, to be in self-quarantine. We have those people now in our community, and so you should not be surprised if you hear about that via social media or other outlets, that there are people that have either traveled to places that are at risk or have community transmission or have been contacts of cases. Again, we've been talking about that for some time. We've had people in self-quarantine, and now we have our first case. Finally, know that the mass gathering order from the governor is something that we have been spending time on this week. We heard about half an hour ago that there will be an update to that order coming out soon, and as soon as we have that information, we will share that. The update to the order, as we understand it, is clarification of some of the exemptions that were listed. Again, we don't have that order yet, and as soon as we do, we will be sharing that. I understand that that's important information. Today, we've spent a considerable amount of time looking at special populations in our community. There was a meeting this morning with many of our local partners to talk through the logistics and locations, particularly related to our population that's currently experiencing homelessness, and really looking at what we can do to make sure those people are safe and healthy as this event moves forward. Yesterday, we all know that we had updated guidance on childcare. That's an important topic for many in our community that have families. We have a group actively working right now on securing and identifying options for particularly our providers and responders to this event to make sure that they don't have to worry about that critical issue during this difficult time. Again, anybody that's working in essential areas in Eau Claire and is seeking assistance on finding childcare providers because of children being out of school, please reach out to Western Dairyland Child Care Resource and Referral. Their phone number is 1-800-782-1880, or go to their website, which is childcarereferral.org. Again, an important issue for many in our community. We've also gotten many questions related to enforcement of the governor's order. We met early this afternoon with a team of our county and local legal experts, as well as our law enforcement representatives from the jurisdictions in Eau Claire County. And we walked through the enforcement of that order. We are confident that the majority of organizations are abiding by that order. We have that kind of community, and we expect that to continue. When and if we have circumstances where the order is not being followed, we will be enforcing that under the authority that we have, and law enforcement is working with us on that. Again, we expect that to be very rare and hopefully not at all. We want to make sure that people understand that these closures that are in the mass gathering order from the governor are important for public health reasons. We know it's challenging to do those things, but it's important that in order to limit the spread of disease, and that's why those orders are in place. We will continue these calls and this way of updating you through the media every day at 3:30. We do intend over the next several days to have a public health nurse, one of our experts that walks the road of following up on a positive COVID-19 case, really walk you through that so our community is aware of how does that work and how do we make that happen in our community. So we'll have a public health expert talk us through that in a call that is happening in the next several days. We'll also be doing an update with some of our lead governmental officials so that you're hearing directly from our leadership of both local and county government, both municipal and county government, directly, so you hear from them their plans to assure essential operations. Again, we are really tracking this event and this issue every minute of every day, I will tell you, and it's a challenge for all of us. We know people are struggling to deal with this, and we appreciate how hard that is. We encourage people, again, to reach out to their family members and talk so that we can decrease the concern across the community. And those of us that are in families, like me, I will go home and hug my daughter again, as I've said in previous calls. She happens to be home with me as a college student that isn't in school right now. We all have people that are challenged with having to walk through this together, so please support one another. Again, our updates will continue, and we'll be back here tomorrow. Are there any questions for today? Yes? Sure. So the question is, what is our process for seeing who are the contacts of an individual positive case? We'll walk through this in much more detail when we have our public health staff people that deal with this. I will say quickly, so people understand what we're doing today. As we found out about the case this morning, we contact the individual directly. We get a list and work very comprehensively to make sure they understand all of their contacts are important. We get that written down and we start making phone calls and reach every one of the individuals that was potentially in a situation where they were at risk of exposure. They then are asked, they are told to self-isolate for 14 days. Self-quarantine for 14 days. Again, these are well people. They are told to self-quarantine for 14 days. And that communication is just clearly happens to that whole list of individuals. Yeah. So the question was, do we have an idea of how many individuals? Again, because we don't share information on specific cases, I won't be responding to that, but we follow up on everybody that the individual identifies as a contact. Yes?
There was one case we were tracking on Johns Hopkins, and they said that one case had recovered in Wisconsin, but it's now back to active. Do you know anything about that?
So the question was about one case that was listed as recovered at one site in Wisconsin and that is now back to active. We are not aware of that. The last look at the state website, our understanding, and we have not heard anything from the state that that is in fact the case.
Child care. Yesterday morning, it seemed that you had addressed that issue and sort of explained why that was an exception. Understandably, then in the afternoon, the governor came out with staff of 10, 50. I talked with a child care provider from a larger facility who said, I don't have words but tears. I mean, can you at least, I know you didn't make that call, but can you try to, from your vantage point, explain why that went into effect? And it wasn't right away.
Sure. The question was, why were child cares initially exempt from the order? Then the state moved them from exempt to having a specific number. So our current situation is 10 employees and 50 or less children in a facility. The reasons for taking that kind of approach in public health is really to limit the number of potentially exposed people and the spread of disease. So the state is taking measures that they feel appropriate at this point in time, given the fact that we do have, particularly in some communities, some fairly broad community spread. We now have another county, Brown County, today identified as having community spread. And the intent of these measures is to really make it more possible to social distance. So many people in the same space, it is all but impossible to follow social distancing ideas. And the fewer people that are in a shared space, the more likely, first of all, that you can have some distance, and the more likely that we can control spread to a smaller group if and when that might happen. We understand it's incredibly challenging for the providers who want to provide care and for the families that are in a difficult situation. For those very large child care facilities, our team is working to see how we can continue care and still meet the requirement, perhaps in multiple buildings, perhaps in other ways, but it certainly is an enormous challenge, especially to sort through in a very short order.
Can you explain briefly how you can go, you have one case and you seem to be encouraged by the limits that this individual put on themselves. Mm-hmm. How you could go, if that's almost a best case scenario if you have one, to a worst case, like you do not, it seems to me you totally do not want community spread. So what are the keys to preventing that from where we're at to that?
Sure. So the question was really, what are the keys to not having kind of the worst case scenario of broad community spread? Really, the keys to that right now, very frankly, are staying home when you're sick, washing your hands, having some social distance, and not convening in large groups. And so those are the consistent messages that we really have reiterated over and over and over again. It's also why we're seeing the orders coming down from the state to really limit the possibility of those things happening. Again, We expect people to take this seriously. We do not want widespread community spread. Again, this is a disease that none of us have natural immunity to. It's a new disease. That's why it's so different than many other diseases where we can control in different ways. So frankly, until we have vaccine availability, we right now are counting on the spread being decreased by basic measures like not being in close contact with a large group of people. So if I'm in a setting and I'm sick with COVID-19 that has hundreds of people around me, I now have potentially shared my disease with those. If I keep my circle very small, and we can think about this as circles, keep your circle small, less spread. Yes?
How many of the county tests are still pending?
So the question was, how many of the county tests are still pending? I do not have that information right now. That is the information that we are trying to make sure is available weekly to you. It is not a report that we currently get easily, and we are working, and we are committed to getting that to you each week. We do know, again, that the State Lab of Hygiene and the Milwaukee Lab are prioritizing running tests based on the prioritized groups. Again, that doesn't mean that other tests won't be run, but at this point in time, the two public labs, the two labs that are governmentally run, are prioritizing testing, and there's really sound public health reasons to do that as well. It may mean that some of our tests are pending for a bit if they are not in that prioritized group. So we will not be surprised if that is in fact the case. Anybody that has a pending test is self-quarantining. And again, we're making sure that as we're waiting for results, that they are not, their circle is small, again, using that analogy. Are there additional questions? Yes?
Follow up. Do you know approximately when you'll have that information?
So the question is, when will we have that information next week? We don't know that. We are waiting for information from the state on how best to run those reports. Any other questions? Yes?
The individual who tested positive, can you say if they traveled outside of the country?
So the question was the individual that traveled outside of Eau Claire, the travel-associated individual that is COVID-19 positive. We cannot give any identifying information at this point in time. We do know that they have a travel history, and we have shared that with you. Wonderful. Yes?
You mentioned this morning that the team is expanding, so what all entities are involved now?
So at risk of forgetting, so I don't want to offend anyone, the question was related to who is all involved. We have partners across the governmental sector that have stepped forward: fire, police, sheriff's department, city hall leadership has been involved, county leadership has been involved, healthcare partners are involved in the response, and many, many others. We are continuing to focus on our emergency management and response team, and we are utilizing a broad sector of people across the community, which makes an enormous difference. Certainly, as this has expanded with all of the measures being taken, we've needed that. So we've been very appreciative of that. Any additional questions? So again, to the community, we really, we know this is a difficult time. We are here to provide you the best information as quickly as we can, and we're committed to doing that. We do have one positive COVID-19 case in Eau Claire County, but that isn't reason for people to be concerned in a different way than they were yesterday. We want people to do the same things that will keep them safe and healthy. They are not in more risk because we've announced that. Those people that have been in contact with the individual are being contacted. Everyone else, please pay attention to general things that we've been sharing. Please go to our website for updated information and follow us on social media. Thank you.